Many Saskatchewan residents may feel like they're done with COVID-19, but that doesn't mean it's done with us. COVID-19 has quietly killed more people in Saskatchewan in the first 5 months of this year than in the same period last year. In total, 434 people died from COVID between January and the end of May. In 2021, 391 people died from COVID in the same time span. Senior Medical Health Officer Corey Neudorf says the Omicron variant may have had less severe symptoms than the variants that came before it, but it also spread faster and infected more people.
You can take the little bit lower proportion of people needing hospitalization or death, but multiply it by the vastly larger number of people actually getting sick. And what it equals is more deaths in this period than in previous waves.
There are no longer any public health measures to control the spread. Saskatchewan was among the first provinces to drop proof of vaccination, and there is no requirement to mask indoors or isolate if you have COVID. But people are still dying from the virus, most of them seniors with underlying conditions.
So you do the math on this and you say, just from a perspective of wanting to avoid unnecessary death in all kinds of people, yes, as a society, we should have done more.
The Ministry of Health did not respond when asked whether its decisions resulted in COVID-19 deaths. Instead, it said that all provinces have seen a higher number of deaths with Omicron due to the high number of people impacted. As Saskatchewan looks to the future, Neudorf says COVID-19 will likely become a seasonal virus, like influenza, which peaks in winter and early spring, and may require booster shots to deal with the new strains of COVID-19. But booster doses have stalled in Saskatchewan. Only 50% of the eligible population had one in February, and an uptake still hasn't hit 53%. That's something that Neudorf says will need to be dealt with by the provincial government before the next wave arrives. Alexander Kwan, CBC News, Regina.